What if the first warning sign of heart failure wasn't chest pain at all? What if it was the cold, heavy ache in your feet right now? Over 6 million Americans live with congestive heart failure. And here's the terrifying truth. Nearly 90% have no idea until it's dangerously advanced. That means swollen ankles you blame on your shoes, cramps you dismiss as fatigue, numbness you think is just age may not be harmless at all. They could be your body's desperate SOS. The tragedy, most people ignore them until they collapse in an emergency room. But the hope is just as real. If you recognize these signs early, you can stop heart failure in its tracks. And that's why in the next few minutes, we'll uncover 12 scientifically proven symptoms in your legs and feet that reveal when your heart is struggling. Knowing them could be the difference between years of life and a future cut short. Picture this: a man in his early 60s sitting by the fire on a winter night. The room is warm, the blankets are thick, but his feet still feel like blocks of ice. He laughs it off, "I'm just getting older." But what he doesn't realize is that those icy feet may be his heart's first cry for help. When your heart begins to weaken, it faces a brutal choice: which parts of your body get priority. The brain, the lungs, the kidneys, they stay at the top of the list. Your feet farthest from the heart fall to the very bottom. That's why cold feet and heart failure feel different from ordinary chill. They don't improve when you move around, rub them, or put on thicker socks. They stay stubbornly cold because the issue isn't in the room's temperature, it's in your heart's ability to pump. Dr. Mark Ellis points to research published in Circulation showing that reduced cardiac output directly correlates with chronically cold extremities. Patients describe it as walking on ice blocks even in the middle of summer. Over time, this lack of blood flow doesn't just make you uncomfortable. It starves the tissues of oxygen, leading to nerve damage, skin changes, and even ulcers that refuse to heal. So if your feet are constantly cold while the rest of your body feels fine, don't just shrug it off as aging or bad shoes. Your body may be sending a desperate SOS about your heart. And ignoring it could mean missing the earliest window to act before it's too late. But only knowing this isn't enough, because there's another warning far more visible, far more serious, that can show up in your legs next. And it may shock you. Cold feet may whisper danger, but swollen ankles shout it. Imagine pressing your finger gently into your ankle at the end of a long day. If the dent stays behind like a fingerprint in clay, that's not normal swelling. That's pitting edema, and it's one of the clearest signals your heart is under strain. Take Robert, a retired carpenter. He noticed his socks leaving deep grooves around his ankles every evening. At first, he blamed his boots. But when the swelling climbed up his legs and wouldn't go away, he learned the truth: his heart was failing to keep up with the returning blood. Here's what happens inside the body in right-sided heart failure. Blood backs up in the veins, raising pressure until fluid seeps out into the surrounding tissues. What looks like puffiness is actually trapped fluid. Your heart can't move. Research in the American Heart Journal confirms pitting edema as a strong diagnostic clue for worsening congestive heart failure. And it's not just about looks. This fluid can eventually move upward, flooding the abdomen and even the lungs, making every breath a struggle. Doctors often recommend daily weight checks, reduced salt intake, and medical evaluation the moment swelling persists. Because catching edema early can mean stopping a silent spiral before it threatens your life. So if your ankles feel heavy, your shoes tighter by nightfall, or your skin leaves deep sock marks, don't dismiss it as aging or bad footwear. Your heart may already be signaling fluid overload. But only knowing this still isn't enough, because there's another symptom that doesn't just weaken your comfort, it robs your very strength, leaving your legs powerless. And once it begins, it changes everything. Swelling may weigh you down, but what happens when your very legs begin to betray you? Imagine climbing just a single flight of stairs and feeling as if you've run a marathon. Your thighs burn, your calves tremble, and your legs give out far sooner than they should. This isn't normal fatigue. It's a sign your heart can't keep up with your body's demand for oxygen. Take Linda, a 58-year-old grandmother. She loved gardening, but soon she noticed that even pulling weeds left her legs shaky. She rested more, thinking it was just age. But the truth was far more serious. Her heart's weak pumping left her muscles starving for fuel. Science backs this up. Groundbreaking research in circulation heart failure found that patients with chronic CHF have reduced levels of essential muscle proteins, especially the myosin heavy chain proteins that power contraction. The result, muscles don't just feel tired, they actually lose their contractile strength. This explains why simple tasks like carrying groceries or even standing in the shower can suddenly feel overwhelming. And unlike everyday tiredness, this weakness doesn't fully recover with rest. Doctors emphasize early recognition because once muscle loss sets in, some of the damage may be permanent even if heart function improves later. That's why noticing unexplained weakness in your legs isn't about getting older. It's about catching a deadly process before it robs your independence. So, if walking short distances leaves you shaky or your legs feel rubbery after the simplest chores, don't ignore it. Your muscles may be telling you what your heart can't say out loud. But only knowing this still isn't enough because the next red flag doesn't just weaken your body, it quietly adds pounds of hidden danger almost overnight. Weak legs are frightening enough, but what if the scale itself starts betraying you? Imagine stepping on it one morning and seeing 3, maybe even 5 extra pounds appear almost overnight. No holiday feast, no late night snacks, just sudden unexplained weight. That's not fat. That's fluid, and it's a classic sign of a heart that can no longer keep up. Consider David, a 62-year-old who checked his weight every morning out of habit. In less than a week, he gained nearly 8 pounds even though his diet hadn't changed at all. He brushed it off as just water weight, but his cardiologist quickly explained this wasn't harmless bloat. It was congestive heart failure silently accelerating. Here's the science: when the heart's pumping, weakens blood flow, slows down. The kidneys misinterpret this as low volume and try to help by holding onto sodium and water. Instead of fixing the problem, the body essentially drowns itself in fluid. Research in the Mayo Clinic proceedings highlights that a gain of just 2 to 3 pounds in 24 hours or 5 pounds in a week often signals urgent heart trouble. Doctors often instruct patients to weigh themselves daily because the scale tells the story before the swelling even shows. Puffy ankles, tighter shoes, rings that no longer fit. These are more than nuisances. They're proof that your heart is overwhelmed and your body is carrying water it can't unload. So if the numbers on your scale jump without reason, don't dismiss it. That sudden heaviness may be your heart waving a red flag. But knowing this is only half the battle, because the next symptom doesn't just weigh you down, it changes the very color of your skin, revealing a truth far darker than most people ever imagine. If sudden weight gain is the body's silent flood, then a change in color is the alarm bell you can actually see. Imagine glancing down and noticing your feet or legs looking oddly pale purple or bluish. You rub them, hoping it's just the lighting, but the strange tint doesn't fade. That's not a bruise. That's cyanosis, and it means your blood isn't carrying enough oxygen to keep your tissues alive. Take Sarah, a 65-year-old teacher who noticed her toenails turning bluish even on warm days. She thought it was poor circulation or maybe just aging skin. But her doctor explained the chilling truth: her weakened heart wasn't sending oxygen-rich blood far enough, leaving her lower limbs literally starving for air. Science backs this up. The ESC Heart Failure Journal documents cyanosis as one of the clearest red flags of inadequate circulation in heart failure patients. It often starts in the toes and spreads upward, especially when sitting or standing too long. Unlike a bruise which heals, cyanosis is persistent. It doesn't go away with movement or massage because the root cause isn't in the skin, it's in the heart's failing pump. And the danger goes beyond appearance. Oxygen-starved tissues heal slowly, fight infection poorly, and can even begin to die if left unchecked. Doctors warn that ignoring cyanosis risks ulcers, infections, and in severe cases, tissue death requiring surgical intervention. So if your legs ever look dusky, bluish, or unusually pale, don't wait it out. Your skin is literally showing you that your heart is falling behind. But knowing this symptom is just part of the puzzle, because the next red flag isn't just visible, it's one of the most common and yet most dismissed signs of all swollen ankles. And it may be the clue that finally connects everything together. If blue or dusky legs reveal a lack of oxygen, swollen ankles expose the heavy burden your heart is carrying every single day. At first, it may look like harmless puffiness, something you notice when you kick off your shoes at night. But when your socks leave deep grooves, when your ankles feel stiff, or when your shoes no longer fit by evening, that's more than water weight. That's your heart sending an unmistakable signal. Take Maria, a 59-year-old office worker. She noticed her ankles ballooning after long shifts at her desk. She blamed salty snacks and sitting too much. But when elevation and rest didn't make the swelling go away, her doctor diagnosed her with early congestive heart failure. What she thought was cosmetic was actually fluid building up because her heart couldn't pump blood effectively back into circulation. Science explains it clearly. As the heart weakens, pressure builds in the veins, forcing fluid out into nearby tissues. Gravity pulls this fluid down so it collects around the ankles first. Studies published in JACC Heart Failure show ankle swelling is among the most common and reliable early signs of CHF. Unlike swelling from injury or a long day on your feet, this type of edema doesn't disappear quickly with rest. It worsens as the day goes on, and it's often most obvious at night. Doctors often recommend immediate evaluation if ankle swelling persists because the same fluid that collects in your ankles can eventually back up into your lungs, making it hard to breathe. Ignoring it risks far more than discomfort. It can spiral into life-threatening complications. So if your ankles seem thicker, heavier, or unusually puffy, don't just laugh it off or hide them under socks. That swelling may be your body's earliest and most visible clue that your heart is under siege. But recognizing swelling alone still isn't enough because the next symptom isn't just about appearance. It's about wounds that refuse to heal, a sign that your heart is failing your body at the most fundamental level. If swollen ankles are the body's waterlogged warning, then wounds that refuse to heal are the scars of a heart in trouble. Imagine a small blister from a new pair of shoes. Normally it should scab over and fade within days. But weeks pass, then months, and the sore stubbornly lingers, sometimes reopening, sometimes turning red and angry. This isn't just poor skin. It's your heart failing to deliver the oxygen and nutrients needed for repair. Take James, a 67-year-old diabetic. He nicked his shin while trimming the garden hedge. What should have been a minor cut became an ulcer that wouldn't close. His cardiologist explained with congestive heart failure, poor circulation starves tissues of healing power, and fluid buildup further blocks the immune system from sending in reinforcements. That little cut became a dangerous wound. Research in the Journal of the American Medical Association confirms that heart failure patients experience significantly delayed wound healing due to impaired blood flow and chronic fluid congestion. Even minor injuries can snowball into infections, ulcers, or hospitalizations. For people with diabetes, the risk doubles, a perfect storm where poor circulation and nerve damage collide. Doctors stress that slow-healing sores aren't cosmetic, they're medical emergencies in disguise. Protecting your skin, checking your feet daily, and seeking immediate care if wounds linger can mean the difference between recovery and severe complications. So if scratches, blisters, or cuts on your legs refuse to heal, don't dismiss them as harmless annoyances. They may be your body's way of showing that your heart is struggling to keep up with life's smallest repairs. But knowing this still isn't enough because the next red flag doesn't just affect healing, it strikes during movement itself, turning every walk into a painful test. Your heart is failing. If sores that refuse to heal reveal a hidden weakness, then pain that strikes while you move is the body screaming for oxygen. Imagine strolling through the grocery store, pushing your cart down the aisle, when suddenly your calves tighten like a vice. You stop, rest for a minute, and the pain fades. But as soon as you start walking again, it's back, deep, throbbing, relentless. That pattern is claudication, and it's a classic red flag of heart failure. Take Eleanor, a 61-year-old who loved walking her dog every morning. She noticed her legs aching after just a few blocks, a heaviness that forced her to stop. She thought it was arthritis. Her doctor revealed the truth: her weakened heart wasn't pumping enough blood to fuel her muscles. Each step was literally starving them. Science proves this connection. The Journal of Cardiac Failure reports that patients with CHF often develop exercise-induced leg pain because their oxygen supply collapses under even mild activity. Unlike ordinary fatigue, this discomfort isn't about sore muscles. It's about circulation that can't meet demand. Over time, it creates a vicious cycle. You move less because of pain, muscles weaken further, and the decline accelerates. Doctors urge patients to take this sign seriously. Tracking symptoms, limiting sodium, and following prescribed exercise plans can help protect mobility before it's too late. Because claudication isn't just uncomfortable, it's your body's alarm that your heart is falling behind with every step you take. So if walking short distances leaves your legs aching, throbbing, or unbearably heavy, don't chalk it up to age or fatigue. Your muscles may be telling you a story your heart cannot hide. But just knowing this won't keep you safe, because the next warning sign doesn't appear when you walk. It strikes at night, robbing you of rest and silently exhausting your heart even further. If pain while walking disrupts your days, restless legs can quietly steal your nights. Picture lying in bed, desperate for sleep, when a strange, crawling, pulling, or burning sensation begins deep inside your calves. You try to ignore it, but the urge to move becomes unbearable. You shift, stretch, walk around. Relief comes only for a moment. Then it's back, tormenting you until dawn. For many with heart failure, this is not just nerves. It's another red flag. Consider Thomas, a 64-year-old who thought his bedtime restlessness was anxiety. But his cardiologist explained the hidden truth: during the day, fluid builds up in the legs. At night, lying flat redistributes that fluid into circulation, triggering nerve irritation and electrolyte imbalances. The result: restless leg sensations that make restful sleep nearly impossible. Science connects the dots. A review in sleep medicine found a strong association between congestive heart failure and restless leg syndrome, driven by fluid shifts and poor circulation. And the consequences go far beyond lost sleep. Night after night of twitching, pacing, and exhaustion leaves the heart under even greater strain. Fatigue builds focus, weakens, and quality of life declines. Doctors encourage patients to track their sleep, elevate legs before bed, and seek medical care if restless legs become a nightly battle. Because what feels like a minor annoyance may in fact be your body's way of warning that your heart is drowning in hidden fluid. So if you find yourself endlessly moving your legs at night just to find relief, don't dismiss it as stress or aging. It may be your body's plea for help before your heart falls further behind. But only knowing this isn't enough, because the next sign isn't about movement or sensation. It's visible to the naked eye as veins in your legs twist, bulge, and worsen at a pace that should never be ignored. If restless legs rob your sleep, worsening varicose veins expose what's happening beneath the surface. Those twisted, bulging lines on your legs might seem cosmetic, something you cover with long pants. But when they suddenly grow larger, spread faster, or become painful, they can reveal a deeper problem: your heart's inability to manage pressure in your veins. Take Brenda, a 63-year-old who had mild varicose veins for years. One summer, she noticed them thickening, rapidly turning rope-like, and leaving her legs heavy and sore. What changed: her heart was failing, pushing higher pressure backward into the veins of her legs, straining the delicate valves that normally keep blood moving upward. Science confirms this pattern. A study in vascular medicine showed that patients with congestive heart failure often experience a rapid worsening of varicose veins. Instead of developing slowly over decades, the veins can deteriorate in months as circulation falters. With pooling blood tissues darken, the skin hardens, and in severe cases, ulcers form around the ankles. This isn't just about appearance. It's a visible sign of venous hypertension caused by a struggling heart. Doctors urge patients not to ignore sudden changes in their veins. While compression stockings and leg elevation can help, the real solution lies in addressing the failing pump that's causing the pressure surge. Because varicose veins that suddenly worsen are not skin deep, they're evidence that your circulation is breaking down. So if your veins look different, feel heavier, or worsen quickly, don't just hide them. They may be your body's billboard warning that heart failure is accelerating, but only knowing this won't protect you. Because the next sign doesn't just change how your legs look, it transforms the very skin itself, sending an even clearer message that your heart is losing the fight. If bulging veins mark the struggle beneath the surface, skin changes show the battle written on the outside. Look closely at your legs. Do they look shinier than before, almost stretched like polished leather? Does the skin feel thinner, fragile, or strangely smooth? These aren't cosmetic quirks. They are visible signatures of a heart struggling to keep up. Consider Henry, a 68-year-old who noticed his ankles turning reddish-brown, almost bruised but with no injury. His doctor explained stagnant blood leaking iron into the tissues was staining his skin. This condition, called stasis dermatitis, often appears when congestive heart failure causes chronic swelling. What starts as glossy puffiness can progress to fragile skin that tears easily, leaks fluid, or even develops painful ulcers. The science is clear. Research in heart and lung confirms that patients with CHF-related edema commonly experience these skin transformations. When circulation falters, tissues swell, stretch, and suffocate. Over time, the skin becomes not only a canvas of discoloration, but also a barrier on the verge of breaking down. And once ulcers or infections appear, hospitalization risk skyrockets. Doctors emphasize the importance of monitoring skin changes closely. Moisturizing fragile areas, reducing salt intake, elevating legs, and seeking medical advice early can slow the damage. But ignoring them is like ignoring your heart writing its distress call across your body. So if your legs look unusually shiny, discolored, or fragile, don't dismiss it as age spots or dry skin. It may be your body showing you the truth your heart cannot hide. But recognizing these changes still isn't enough, because the final symptom goes deeper. It's not about how your legs look, but how they feel with numbness and tingling that could change the way you walk forever. If skin changes are visible to the eye, numbness and tingling are the hidden sensations you can't ignore. Picture walking across your living room and suddenly feeling as if your feet are wrapped in thick cotton or like you're stepping on pins and needles. Some describe it as buzzing, others as burning, but all of them signal the same alarming truth: your nerves are suffocating because your heart is failing to deliver enough oxygen-rich blood. Take Carol, a 66-year-old retiree. She thought her tingling toes were just neuropathy from age, but when swelling joined the numbness, her doctor traced the real culprit back to heart failure. Fluid buildup compressed her nerves while poor circulation starved them of oxygen. The result was constant misfiring, false signals of tingling and burning that made walking a daily challenge. Science backs this up. Current heart failure reports highlights how CHF patients frequently experience nerve-related symptoms in the feet stemming from both pressure and poor oxygen delivery. The danger isn't only discomfort. Numbness increases the risk of falls, mobility loss, and unnoticed wounds that can spiral into infections. Doctors urge patients not to dismiss tingling or numbness as just age. When these sensations appear alongside swelling or discoloration, they often mark advancing heart failure. Protecting mobility means acting quickly, checking feet daily, reporting new symptoms, and following treatment closely. So if your feet tingle, burn, or go numb, don't ignore the message. Your nerves may be telling you your heart is losing ground. And that brings us to the most important part: not just recognizing the signs, but knowing what to do next, because your future health may depend on it. Taking care of your heart starts with paying attention to the small signals your body gives you. Don't ignore cold feet, swollen ankles, or unusual skin changes. Addressing them early could protect your independence and add years to your life. If you found today's insights valuable, I encourage you to save this video and subscribe to the channel so you'll never miss the latest medical guidance designed to safeguard your heart health. Remember, you're not alone on this journey. Every step you take toward awareness is a step toward strength, resilience, and a future filled with more time, more health, and more moments with the people you love.